It's an understatement to say that we are in uncharted waters, and we know the extraordinary steps we've been taking and the impact that we're placing and will continue to place on many of our citizens. But we are humbled by the daily creativity and resiliency that we see from the people of this remarkable state. And our admiration over the past 2 weeks has only grown. Without question, we are likely to have some very tough days ahead of us as we are still at the beginning of this battle against this virus. But we continue to have great faith and confidence that we will get through this by pulling together, caring for one another, and doing what's right for our neighbors and our communities, because that is who we are. When we have taken unprecedented and strong action, I want to address the ongoing rumors about a possible order to shelter in place. I've spoke about this before, but let me be clear. We are not planning any shelter-in-place orders. In times of crisis, it's imperative that everyone get their news from legitimate places, and sometimes that's not from your friends, neighbor. We urge all citizens to please bookmark mass.gov/COVID-19 and regularly check there for any and all updates. And keep in mind, again, that for the vast majority of people, approximately 80% of the population, COVID-19 would mostly feel like the flu. The infection would not lead to hospitalization. Your body fights the infection, and you recover. But the reason we're taking this so seriously is because it is incredibly contagious. It's a lot more contagious than the regular flu. There will certainly be more cases of COVID-19 here in Massachusetts, but we also know that if we take decisive steps now and everyone plays their part by following the best medical guidance, we can slow down the spread. And our healthcare system will be better positioned to care for the people who really need it. With that said, today we're announcing several new elements and initiatives. First of all, our administration, through the Command Center, will be distributing a down payment of $5 million in emergency funds to local boards of health across the Commonwealth. That money will go out today, and more will follow soon. I signed this appropriation into law after it was allotted by the legislature at the end of last week to address the immediate needs of our community health boards in addressing COVID-19. Most of this money will go directly to our cities and towns to help them respond to this public health emergency. We also plan to execute emergency contracts with our cities and health districts that have sufficient capacity to receive and utilize funding, and will continue to move through this process quickly. Our largest municipalities, which have over 70,000 residents or more, and our public health districts will receive contracts today. Other local boards of health will receive more information from DPH today. And in addition to providing funding for municipalities, we're also extending our reach to offer support where needed to cities and towns. We also signed 2 emergency orders, and the Commissioner of Public Health has issued 2 orders as well to expedite the onboarding of more licensed healthcare professionals. These orders will make it easier for licensed healthcare staff, including registered nurses, licensed practical nurses, and respiratory technicians, to work at another licensed facility. These orders will cut red tape so hospitals can staff up faster. This will also allow out-of-state licensed physicians in good standing to practice in Massachusetts and enable retired physicians in good standing to reactivate their license. Again, this is all about helping to expand our healthcare delivery capacity. Recognizing the crucial need for sufficient EMS capacity during this public health emergency, these orders also adjust minimum standards for ambulance staffing to ensure sufficient availability and capacity of EMS services. And finally, these orders will also facilitate telehealth across state lines. This builds off the emergency order we issued on Sunday for all commercial health insurance carriers to allow providers to provide services via telehealth. What this means is that by working with their healthcare provider, patients can talk to their doctors via video or phone, so they do not have to visit a doctor's office. The significant measures we've taken in the past few days will help mitigate the spread of COVID-19, but there is no denying that this causes major disruption for our economic sector and especially the Commonwealth small business community. Yesterday, we announced economic support for small businesses with a $10 million loan fund to provide financial relief. But it's crucial we bring every resource to bear to address the economic disruption caused by COVID-19, including those available from the federal government. I was glad to see the feds talking earlier today about a major recovery package. Last Thursday, MEMA took the first step in the process of securing relief from the Federal Small Business Administration, conducting a survey to identify businesses affected by the COVID-19 outbreak. Today, I am formally requesting that the Small Business Administration issue a declaration of economic injury for the Commonwealth. This declaration would make it possible for low-interest loans to be made available to business owners affected by the outbreak of COVID-19. Everybody knows the economic disruption is real, but we are committed to pursuing a variety of solutions to help mitigate these effects. It's my hope and expectation that both the state and federal government will have more to say about this effort as time goes on so that we can help as many people as possible recover from the widespread impacts of this disease. As a reminder, we've also taken the following steps over the past couple of days. We're relaxing some of the requirements around current unemployment claims. This will allow many of the workers affected by closures to get some financial relief. We filed emergency legislation with the legislature that will allow new claims to be paid more quickly by waiving the one-week waiting period for unemployment benefits, and we met with the legislative leadership yesterday to discuss this and several other short-term issues. I look forward to working with them to get these measures passed as soon as possible. On Sunday, we also instructed all non-emergency state employees from the executive branch not to report to work yesterday and today unless they were essential to the state's COVID-19 response efforts. Over the past few days, we've had productive talks with the unions and leadership across our agencies, and later today, we'll be rolling out updated information and guidance for executive branch employees around telework and what they should expect going forward. I want to say at this time that I really appreciate the level of effort and the commitment and the cooperation that so many people put in on this one over the past 48 hours. And I think as many people know, effective today, bars and restaurants in Massachusetts that offer food and drink shall not offer on-premises consumption. These establishments may continue to offer food for takeout and delivery. This order is in effect for the next 3 weeks. And it's important to note that this order does not apply to grocery stores, retail outlets, or pharmacies. This is about bars and restaurants and those places that people do not absolutely have to go to. Many folks have noticed grocery store shelves seem bare. The reason for this is because people are perhaps going a little overboard to stock up on supplies. Please use common sense and moderation and avoid hoarding large quantities. The shelves are getting restocked pretty much every night. And for responsible planning advice, you can always visit mass.gov/know, plan, and prepare. On a final note, I want to thank everyone again for their patience and perseverance during these unprecedented and difficult times. Your cooperation and diligence are vital to keeping you, your family, your neighbors, and our community safe, and I'm confident that we're going to get through this together. I would also like to ask everyone to remember the most vulnerable among us and ask that you reach out and help if you can. I know there are programs that are being put up in communities all over the Commonwealth, which comes as no surprise, I think, to any of us. Call your neighbors, your friends, your families. A check-in can go a long way right now in helping someone get through their day.